Okay, CCS prep case number 2. Let's get into it. Okay, so domain 1, remember, this is the heaviest domain for the CCS exam, all right? So this scenario, a patient was discharged with the following diagnoses: cerebral artery occlusion, hematopoiesis, and hypertension. The aphasia resolved before the patient was discharged. Which of the following code assignments would be the appropriate for this case? Now, here are the available codes, just in case you guys don't have your book. Now, look at the choices. Is it A, B, C, or D? Let me lift this up a little bit just in case you can't see D. All right. Well, join me in the next video. I will reveal the answer and the rationale behind it. Okay, if you selected answer B, then you are correct. All right. So here's why B is correct. The documentation stated cerebral artery occlusion without any mention of infarction. Okay. This is your first big clue. Occlusion alone lives in I66. Occlusion with infarction lives in I63. Never assume infarction that is not documented. Hematopoiesis is documented, but the side is not specified. So when laterality is not stated, you code unspecified side, all right? So that's captured in G81.90. Do not guess right, left, dominant, or non-dominant. The aphasia resolved before discharge, but it was present during the admission and impacted care. So per UHDDS, conditions that were treated or monitored during the stay are still coded. Resolved does not mean deleted. So R47.01 would stay on the account. Hypertension gets its own code, I10, because there's no combination code trigger. Okay? If the patient had hypertension with heart failure would be I11.0, but there was no heart failure documented. All right? So let's look at it. Here's my process of elimination. I want you guys to always use this when you're going for your exam. Eliminate A first. I63.50 requires documented cerebral infarction. Let me bring up real quick the answers, okay? So we're eliminating that. A, right? There was no stroke. Infarction is a stroke. Okay? So we eliminated A first. Now eliminate C. C is missing R47.01 for aphasia. Resolved does not mean uncoded. So we eliminated real quick A. Just think if you're taking your exam, you have to move quick. Not quick, but you have to have strategy. So remove A, right? And remove C. There's no R47.01. So now we're left with B or D. So we eliminated C. So between B and D, look at laterality. D uses G81.92. That's left dominant side. Ask yourself, was that documented? Nope. So never assume laterality. So that's gone. B is what is left, and B is right. Okay? So look at the codes again. You see that? All right, so remember, the word occlusion versus occlusion with infarction changes the entire code family. Read the exact words. Resolved conditions are still coded as if they were treated or monitored during the stay. And when laterality is not documented, unspecified is the correct choice. Never guess, all right? So if you need help with studying, if you want to get into inpatient medical coding, you guys, I'll leave it in the caption.